I'll tell the story about a patient who I've gotten to know who's relatively new to my practice. He's a former truck driver, and because of his job, he developed all sorts of health problems. He was on the road a lot, didn't have an opportunity for much exercise, eating a lot of fast food. So he developed a lot of the things you would expect with someone who has a job like that: obesity, high blood pressure, high cholesterol. And while he was working, unfortunately, he actually also developed a debilitating chronic illness, which prevented him from continuing to drive trucks. Uh, Lucky for him, he had access to disability benefits through his company. So now that he's not working, he's on disability, but this chronic illness that he has is actually getting worse and worse. And unfortunately, the disability that he's on doesn't cover the medications that he needs. So he's new to my practice, and when we met, he had these problems of high cholesterol, being overweight, of high blood pressure, in addition to the illness that he was already dealing with. He's on a limited income, and he couldn't really afford the medications that he needed. He was making the choice between spending money on the medications he needs on the one hand, and then finding money for healthy, nutritious foods on the other hand, finding ways to access exercise programs. So he was faced with a very difficult choice. There's when he does come in and he doesn't have medications, we can fill the gap from whatever we have lying around in our sample cupboard, but oftentimes that's not the most appropriate therapy. So we're relying on this incredibly patchwork solutions to this very fundamental problem for him and many other Canadians. I think it's easy not to talk about Pharmacare, because what we have now is a patchwork system. It's where we're all existing in silos, and we're not really doing what's best for each other. It's harder to talk about these things that require collective effort, because it's about more than us being out on our own, doing our own thing. It's about having conversations with each other, and not just about doing what's best for us in this moment, but building a legacy for our families, for our children, but also for all the Canadians and the future Canadians that are going to come after us. When Tommy Douglas created Medicare, it wasn't a vision just for people in Saskatchewan. It was a vision for the rest of the country. It wasn't something that was operating on a 4-year election cycle. It was something that he was investing a huge amount of himself in, a huge amount of social and political capital, because he was well aware of the implications it had for the health of Canadians. And the second stage of Medicare, of which Pharmacare is a part of, is in the spirit of that same social project. It's about us banding together and looking after ourselves as one strong country.